Hello, I am Anne, the Human Resources Advisor for MAT Mission in MSF headquarters. I will provide you very brief information about your next mission, but mainly focused in human resources. Just for you to be aware of our main human resources challenges there in MATBA. As you may already know, our main partner there since a few years that we are operating in MATBA is the Ministry of Health. They face a lot of challenges, but the main one is the lack of human resources in the isolated areas. Most of rural health centers in ReHuCo district are understaffed, have a huge turnover, or they receive only inexperienced nurses, temporarily detached there until a more appealing detachment is available for them. Therefore, one of our work lines is making the work in the rural health centers a bit more appealing, basically improving their living and working conditions. Another big challenge is the corrupted system. This affects also motivation, especially of those really committed with the Hippocratic mandate. If you add this to the low management skills and the lack of leverage that managers have to motivate their staff, you may feel like hitting a wall each time you want to change something. Our staff there has mentioned quite often in their debriefings the frustration of working with the Ministry of Health as a partner. Nevertheless, we are managing, little by little, to change things. I would advise you to build some kind of relation with your counterparts in the Ministry of Health in order to fully understand challenges and points of view. This could also apply to our MSF staff there. Changing things are difficult but not impossible. Sometimes they may seem resigned and fatalistic about changing a particular topic, but if you show the steps to be followed, they may be on board. It is worth mentioning that we recaptured some staff from a former MSF project in the country in order to work in our project in ReHuCo. This was key to rapidly achieve a kind of standard, but their motivation is especially tricky now that some months have passed and that they find themselves in the routine, but far from their families. Working in capacity building and offering new challenges may be the key for success. Regarding the international staff, I think that we have a very good team there in ReHuCo. Very good balance between experienced and new staff. For example, the field coordinator is first mission at coordination level but has very good competencies. The medical team leader, for instance, is really experienced. This balance is important because on one hand the more experience can guide the others into the correct path, but the new ones can bring enthusiasm and a critical view. Security-wise, I am worried about one sexual harassment episode denounced lately. Not violent, but important to react appropriately and with due diligence. Well, as a wrap-up, the project is probably not very demanding in terms of technical issues, but it is in terms of management. Please relay on your coordination team in Celaya. They are there to support you. Remember to take the basic health prevention practices related to HIV and malaria. It is a high prevalence country for both diseases. You will probably receive a detailed briefing on that from the medical coordinator in Celaya. Take care of yourself and be alert to stress symptoms, not only on you but also in your fellow colleagues. I will share with you by email the latest contextual information, mainly press review and latest country key events. I hope that you enjoy your mission.